Welcome to How to Lose Weight and What I Eat in a Day channel. In this video, get informed of the history of healthcare in Canada as a summary. Presentation. Canada's freely supported medical services framework is dynamic. Changes have been made in the course of recent many years and will proceed because of changes inside medication and all through society. The essentials, notwithstanding, continue as before. Widespread inclusion for therapeutically vital medical care administrations gave based on need, as opposed to the capacity to pay. The essential estimations of decency and value that are shown by the ability of Canadians to share assets and obligations are shown in Canada's medical services framework and have been reflected in the alterations and significant changes made to the framework since its beginning. The framework has been and keeps on being altered as the nation's populace and conditions change, and like the idea of medical care itself advances. Development of our healthcare system. When all is said and done, Canada's constitution sets out the forces of the bureaucratic and the common and regional governments. Under the Constitution Act, 1867, the regions were liable for setting up, keeping up, and overseeing medical clinics, havens, a noble cause, and beneficent establishments, and the national government was given locale over marine medical clinics and isolate. The central government was additionally offered forces to burden and acquire, and to go through such cash as long as this didn't encroach on commonplace forces. The Government Division of Agriculture covered bureaucratic well-being duties from 1867 until 1919 when the branch of health was made. Throughout the long term, the obligations of the two degrees of government have changed. Prior to World War II, medical care in Canada was, generally, secretly conveyed and financed. In 1947, the Public Authority of Saskatchewan presented a territory-wide, all-inclusive clinic care plan. By 1950, both British Columbia and Alberta had comparable plans. The national government passed the Hospital Insurance and Diagnostic Services Act in 1957, which offered to repay, or cost-share, one portion of commonplace and regional expenses for determining medical clinic and indicative administrations. This act accommodated freely controlled all-inclusive inclusion for a particular arrangement of administrations under uniform terms and conditions. After 4 years, all the areas and regions had consented to give freely financed inpatient emergency clinics and demonstrative administrations. Saskatchewan presented an all-inclusive, commonplace clinical protection intended to offer specialist types of assistance to every one of its inhabitants in 1962. The national government passed the Medical Care Act in 1966, which offered to repay, or cost-share, one portion of commonplace and regional expenses for clinical benefits given by a specialist outside clinics inside 6 years, all the regions, and had widespread doctor administration protection plans. From 1957 to 1977, the government's monetary commitment on the side of medical care was resolved as a rate one portion of commonplace and regional consumption on protected emergency clinic and doctor administrations. In 1977, under the Federal Provincial Fiscal Arrangements and Established Programs Financing Act, cost-sharing was supplanted with a square asset. For this situation, a mix of money installments and duty focuses. A square asset is an amount of cash given starting with one degree of government then on to the next for a particular reason. With an exchange of assessment focuses, the government diminishes its expense rates, and common and regional governments at the same time raise their duty rates by an identical sum. This new financing course of action implied that the common and regional governments had the adaptability to contribute medical care subsidizing as per their requirements and needs. Government moves for post-auxiliary training were likewise added to the well-being move. In 1984, government enactment, the Canada Health Act, was passed. This enactment supplanted the Government Emergency Clinic and Clinical Protection Acts and merged their standards by setting up measures on compactness, openness, all-inclusiveness, extensiveness, and policy implementation. The Act likewise added arrangements that disallowed additional charging and client expenses for guaranteed administrations. Government enactment passed in 1995 united administrative money and assessment moves on the side of medical care and post-optional training with bureaucratic exchanges on the side of social administrations. And social help into a solitary square financing system, the Canada Health and Social Transfer (CHST), starting in the monetary year 1996-1997. A concurrence on well-being came to in 2000 by the bureaucratic, common, and regional government pioneers, or first pastors, set out key changes in essential medical services, drugs the executives, well-being data and correspondences innovation, and well-being hardware and framework. Simultaneously, the government expanded money moves on the side of well-being. In 2003, the primary priests conceded to the Accord on Health Care Renewal, which accommodated underlying change to the medical services framework to help access, quality, and long-haul manageability. The Accord submitted governments to pursue focused on changes in regions, for example, quickened essential medical services restoration, supporting data innovation e.g., electronic wellbeing records, telehealth. inclusion for certain home consideration administrations and medications, improved admittance to demonstrative and clinical hardware, and better responsibility from governments. Under the Accord, government money moves on the side of medical care were expanded, and the CHST was part of the Canada Health Transfer for Wellbeing and the Canada Social Transfer for Post-Optional Instruction, Social Administrations, and Social Help, compelling April 2004. Further changes were reported by the first clergyman in a 10-year plan to strengthen healthcare in 2004. The administrative, commonplace, and regional governments focused on a medical care recharging plan that remembered run after changes for key regions. For example, standby times the board, wellbeing HR, Aboriginal wellbeing, home consideration, essential medical services. A public drug technique, medical care administrations in the north, clinical hardware, counteraction, advancement and general wellbeing, and upgraded providing details regarding progress made on these changes. To help the plan, the national government expanded medical care money moves including yearly increments to the Canada Health Transfer from 2006-2007 until 2013-2014 to give unsurprising development in bureaucratic subsidizing. In spring 2007, all regions openly dedicated to setting up a patient wait times guarantee in one need clinical zone by 2010 and to undertaking pilot ventures to test ensures and illuminate their usage. A patient wait times guarantee is the proposal of elective consideration alternatives, e.g., reference to another doctor or medical care office, to patients whose standby times surpass a characterized time span when therapeutically vital well-being administrations ought to be given. For more detail on the historical backdrop of our medical services framework, allude to the assets toward the finish of this leaflet, the timeline, additional reference sources, and online resources. The role of government. The Association of Canada's Medical Services Framework is to a great extent dictated by the Canadian Constitution. In what jobs and duties are split between the administrative and common and regional governments. The common and regional governments have the majority of the duty regarding conveying well-being and other social administrations. The national government is likewise liable for some conveyance of administrations for specific gatherings of individuals. Openly supported medical services are financed with general income raised through government, commonplace, and regional tax assessment. For example, subscribe and turn on the notification bell for future updates of my videos.